slides?
Yes.
Excellent. Again, welcome everyone to the Arch Collaborative. We're going to zip through this beginning part because we really want to get to the meat of our meeting, and that's hearing from all of you. Just a quick review of the agenda today. We're going to do introductions and have a few polling questions. While you're joining us, please feel free to go ahead and enter your name and where you're from in the chat box. That would be wonderful. We're going to have, as we always do at the beginning of these collaborative meetings, a quick discussion about future discussion topics so that we're sure we're addressing the major issues that you're most concerned about. I am going to do a really quick overview of voucher program changes, mostly in our network, that have occurred due to COVID-19. We're then going to talk about a very exciting new dissemination of the Respite Voucher Survey, and then move into small breakout rooms for small group discussions. And then the last few minutes will be dedicated to reporting back some major takeaways from those small groups and give you all a chance to share any updates or other information that you might want to share about your programs. Just for those of you who are new, and we do have always new members of the collaborative, so that you know if you want to catch up on past calls or resources or webinars, please know that everything is posted or archived on that Voucher Learning Collaborative website, and you see the link there in the middle of the slide. If you're also interested in the survey results from the last time we did this survey in 2018, those are posted there as well. And now I would like to give our Voucher Learning Collaboratives an opportunity to introduce themselves. These are some amazing people who are doing amazing things with respite vouchers in their states and have agreed to step forward and be leaders for the collaborative, and to the extent that they're able to, be mentors to all of you as well. So let's let each of you introduce yourselves. And Nadine, why don't you start?
Good afternoon, everybody. It's afternoon here in Oklahoma. Not sure where everybody's at, but welcome. I am Nadine Walter, and I work with DHS Aging Services, the State Department, and I've been with the Lifespan Respite grant for, I guess, this is the 7th year now. So we've come a long ways, and excited to share some of our vision and things that we've done. And talking about amazing, Jill, thank you for putting this all together for us. You're great.
Thank you, Nadine.
I think Ronell is on.
Yes. Hello, I'm Ronell Baker. I am with Sooner Success. I work on the Lifespan Respite grant as well as some other things. I think that's all I got. So you're going to see a sneak peek of my 2 kiddos as they keep coming in and out. So
we're happy to see them.
Tracy.
Welcome everyone. Tracy Callow out here in the Pacific Northwest in Washington State, and really thrilled to see all of you coming through from so many different places. And it's just a wonderful opportunity to be part of this collaborative, and so grateful for each of you, and also my partners in crime who are with us on this meeting. So excited about that. And we've had the voucher program at PAVE in Washington State since 2018.
Again, thanks to all of you for your leadership of the collaborative, and we really rely on these folks to help plan the Voucher Learning Collaboratives and provide the substance for the meeting. So thank you very much. I have a quick poll for all of you now that I hope to share, if I can figure this out. This is just, again, to get a sense of where you are in terms of implementing a voucher program. To find out if you are currently implementing a program, or if you are maybe considering implementing a program, or maybe you're already in the planning stages. But it would really help us get a sense of our audience today. So I'll give you a few more seconds to respond. I know some of you are still typing in your names and where you're from. If you haven't done that yet, please Let us know who's here.
And Jill, I don't know if Cassandra or Susan got to say hello.
Oh, of course. Cassandra and Susan, do you want to introduce yourselves while people are taking the poll? We only have 7 people who've taken the poll so far, so don't be shy.
Well, hello, I'm Cassandra Furman, also in the great state of Washington, where the sun is out in the Seattle area. And I'm with ARCH, National Respite Network.
And I'm Susan Summers with ARCH. I'm also in the great state of Washington, where it's sun's sort of out. And I'm really thrilled to be here. I've been hearing good things about this learning collaborative, so I'll learn a little bit too.
And for those of you who are new to this group, Cassandra runs a similar learning collaborative on performance measurement. And Susan runs a very wonderful small group that meets monthly on sustainability planning. So if you're not familiar with those collaboratives and you'd like to be part of that, please let me know and I'll share that information with Cassandra and Susan. Okay, it sounds like the poll, I'm going to relaunch the poll because it closed quickly. I must have set an automatic timer, so I'm reopening the poll. And please do it again, just so we get so few people had a chance to respond.
Looks like we're up to 19 and we have 30 participants. So I don't know if you want all 30, Jill, but we certainly have a
Some
wide
people are
range.
still having trouble making selections, so I think we'll move on. As Tracy said, we've got 19 folks who've responded. The majority of whom, 84%, are currently running the respite program. So I really want to welcome those who are considering or in the planning stages, and I hope that the collaborative will be very helpful to you. Now moving on to the next question. Next discussion. As I said, we want to spend a few minutes just talking about possible topics for future discussion. On the last call, we had some wonderful suggestions about spending some time talking about outreach. How do we better reach family caregivers to participate in our respite voucher programs, especially during the pandemic when it's harder to find caregivers who may need these services. And we're still searching for some of you who are doing excellent work in that area. And if you're interested in presenting on the topic of outreach, please let me know and we can make that a future topic, if not the next topic for the next call. But I'm going to turn this over to Nadine and she's going to review some previous documents that we prepared and have a quick discussion about future topics.
Thank you, Jill. Jill, are you going to open up that document?
I certainly could.
So in the years past, we've
Can you all see that? I'm sorry, before you get started.
no.
Okay, I have to.
So I'll talk while she's bringing that up. In the years past, we've had certain hot topics that people wanted to discuss. And so we just started to combine all those into kind of categories that would they would fit under. And so this is not only just for those of you that are thinking about starting voucher programs, but I know I learned so much from the seasoned voucher programs also. So there's something in here for everybody. I feel like for each one of the I guess you call each one of these sessions that we would have, and kind of pay attention because after this, Jill's going to run a poll for you to pick your top 2 sessions that you would like to see. The first one, what type of caregivers or care recipients, who are you serving? Who do you want to serve? And you'd be surprised, we're all unique. Nobody's voucher program's the same. I think Jill could attest to that. Everybody has their own little, I guess, twerk, or everything's some might be a little different, and that's okay, because we're trying to meet the needs of our caregivers in our state. But for, again, who are we going to serve? How do you determine the funding priority? Do you use a needs assessment? First come, first serve? What should the income or resource requirement be? Or do you even have an income resource requirement? So those are some of the things that kind of fall under that. I'm going to call them sessions, if that's okay, Jill. Then if you go down, there's like, what type of voucher program do we want? Or do you want? Should we reimburse only licensed agencies, or can families select anyone? If you are offering vouchers directly to family caregivers, do we reimburse them or provide vouchers up front and let them pay providers directly? Again, there's all types of different scenarios here. And so that's another session that could be offered. Another one, what type of respite providers will we allow? Does your state already have regulations for vetting or training of providers that you will have to meet? Will you train respite providers? Will training of respite providers be required? If so, how will providers be trained? So as you can see, there's a lot of questions under each one of these and a lot of discussion. I know we always run out of time every time we start have one of these sessions. It seems like we have a lot of good questions, we have answers, and sometimes we don't have answers. We have to kind of brainstorm and think among ourselves. Another one, there you go. What administrative issues needs to be addressed? What data collection process and measures should we use? Just from personal experience, that's very important. Your data collection is getting more and more important. So should we collect outcome data? What type of outcome data should we collect? Why is outcome data important? What type of staff training is necessary to effectively administer respite vouchers? So again, there's a lot of topics under here that could be discussed. Do we need a policy and procedures manual? And then the last one of the 5 sessions, what are the liability, fraud prevention, and tax issues? There's a lot of conversation that comes under these. What are the tax implications for the family caregiver or for the provider? How will we prevent fraud? How do we reduce process demands, streamline procedures, avoid bottlenecks, and still keep checks in place? So I just kind of read off a few of them. I didn't want to take time to read all of them, but those are kind of the 5 kind of hot topics that we've had in the past. And I've heard them all, but I'm excited to hear them again. There's always different things that come up. So Jill, I think unless you have something to add to that, we could go to the polling and see what everybody's top 2 are.
Okay. Thank you, Nadine. That was very helpful. And of course, you know, we want you all to be adding to this list as well, which is why we have the second question. And I hope it doesn't go as fast as the first one. And I also have it on a slide here, so you can see some examples of, and Nadine talked about a lot of these already, but when we talk about type of voucher program, it could be consumer directed programs, direct reimbursement to family caregivers or providers. If you'll allow family, friends, and support networks to be providers. Under provider requirements and qualifications, that includes issues, you know, like do you impose age limitations on providers, training requirements, background checks. Again, administrative issues cover just about every aspect of implementing a lifespan program, using a fiscal management agency, policy and procedures manuals, data collection tools. Okay. Has the polling all ended for you already? Or are you still able to?
It's still up for me.
Okay, let's let it go. This is a long one. People are still responding a little bit.
It's 22 out of 27, so 81% have voted.
Thank you, Tracy.
Doing good. Everybody's doing a really good job.
This is a hard question with a lot of things to consider. And maybe
And Jill,
too late.
we're-
Oh, go
we're
ahead.
sorry. I was going to say, we're using today's poll to try to guide us to what would rise to the surface first. Not that any one of these is going to be like chucked to the side, just more like what's on the collaborative's mind at this moment to lean into for future meetings.
Yes, exactly. That's exactly right. All of these issues are important and hopefully we'll get to all of them at some point. But as Tracy said, which ones rise to the top for the most immediate needs? And it's across the board pretty much. So many issues fall under administrative issues or type of voucher program. And those are the top two right now. So if you want to put in the chat, maybe under administrative issues, for those of you who responded, administrative issues, tell us more specifically what type of administrative issue you might be most interested in. I think that would be really helpful. Thank you all for taking that poll. It was very, very instructive. Now I just want to, and again, feel free to enter anything in the chat, any issues that maybe we missed that you'd like to learn more about. If anybody wants to take a minute to even talk a little bit about an issue, maybe we can take 5 minutes to, if you want to unmute yourself and talk a little bit about an issue that you really have pressing that you'd like us to focus on next time, that would be great. Oops.
And Dina may unmute herself, but just to let you know, Jill, in the chat, she did say to everybody that they found that document very helpful in developing discussion questions with our work group that launched in January. Ironically, we had our second work group meeting this morning. Other folks, Yuta in Arizona is saying how to align with and or differentiate from AAA programs. And Cheryl is sharing out with everybody role of state coalition in administering vouchers.
All really great
Cheryl,
questions.
Nevada, not Cheryl, Alabama, I believe.
Right. All great questions.
And now Joe from South Carolina selling folks admin issues, data collection and analysis. So thank you all for those comments and keep them coming.
And the Learning Collaborative, we will take this information and plan out our next call based on what you've shared with us. And again, if any of you have expertise or models and on any of these issues that you'd like to present to the group, please let us know. And we'll let you know which issues will be rising to the top and seeking your guidance on who might want to present as a case study.
And as I see the data collections turned up twice, are there any specific things you can talk about? Methods of collecting data, what data elements you want to collect? I'm just curious if anyone wanted to go in more detail about that.
They could also join the Performance Measurement Collaborative.
They both of them that I saw the notes were in there, so don't worry. I'll get into it deeper.
All right, well, let's move on to talking a little bit about what is happening to respite voucher programs and other respite approaches across the country as the pandemic continues to roll on. I'm sure most of you are aware of the changes that have occurred to Medicaid home and community-based services waivers, since this happens to be the largest federal source of funding for respite care. From the very early days of the pandemic, states started submitting Appendix K amendments to their HCBS waivers to make pretty important and I hope trend-setting changes to their home and community-based services, many of which are respite services. So all of these things affect respite. And some were specifically mentioned in their amendments, but these changes allowed states to add respite if they didn't have it in their waiver previously. They allowed states to change who can provide respite, to now allow a relative of a waiver participant to provide services. Many of the waivers permitted payments to family caregivers to pay them for their services as personal care attendants or whatever role they are in as caregivers. Increasing payment rates to ensure that there were enough providers out there to continue to provide respite and other community-based services. Increasing the number of hours of respite that are generally permissible under the waiver. Expanding settings where respite services could be provided. Expanding self-direction in home and community-based services and respite. So all of these changes have been very dramatic, have really addressed flexibility to enhance the use of respite across the board, as well as other community, home and community-based services. So critical right now, especially as day programs, nursing homes, other facility-based settings have closed or reduced availability, and more folks being cared for at home by family caregivers. This increased flexibility is very important. And the advocacy community is completely dedicated to making most, if not all, of these changes permanent. Right now, most of them are not permanent. So we're hoping that we'll be able to demonstrate how successful these efforts are and continue them through the Medicaid program. In terms of the grantees and partners, here are just a few examples of alternative respite opportunities or other caregiver supports that coalitions or grantees were able to provide. Many thanks to the Administration for Community Living to giving grantees the flexibility to use their lifespan funds for these services. And again, these are many, the items that I'm showing you today are things that we learned about fairly early on in the pandemic, maybe the first 3 or 4 months. So I know a lot of you have many new wonderful changes to your programs or additions to your programs to add. And that's why when we talk about the voucher survey later, you'll see why it's so important that we continue to collect this information. Alabama, I know a lot of you saw a lot of the very early live Facebook education sessions that they were doing on a regular basis. New York, I know they did this outside of their Lifespan Respite grant, but I think also, and you can correct me, Dina, if I'm wrong, also were given permission to use their lifespan funds to purchase robotic pets for family caregivers and the folks they were caring for to help reduce social isolation. Tennessee had a wonderful mini grant program for caregivers that they could use to pay for exercise programs, for magazines, for online films. And they were also able to distribute computer tablets to families who needed some assistance with technology so they could access all of this remote and online support. Wisconsin continued to make their stipend, their caregiver grant program available to families, but with so many families not feeling comfortable using respite, they developed a training for caregivers on the new normal. They were one of the first coalitions to do the care package deliveries, and I know a lot of you are doing that now. That really, and Cheryl Donnell talked about this on our last Voucher Learning Collaborative, how important these connections were to family caregivers who were feeling very, not only socially isolated, but lonely because of the social isolation, and knowing that there were others out there checking on them went a long way to providing continuous support. In terms of some of the changes to voucher programs that we're aware of, Oklahoma, for example, increased the dollar amount of their voucher. They expanded provider eligibility to include someone who lives with the caregiver and care recipient. That was not allowed previously. They lifted their household income requirement so that more family caregivers could partake of the voucher services. North Dakota waived some of their requirements, again, about providers living in the same household, allowing virtual respite. And one change I thought was very interesting, that they made funding available regardless of how much respite the caregiver was receiving from other public funding sources, just to make sure they were getting enough respite. Nevada with, I think about 50% of families, or just under 50% of the family caregivers in their pilot voucher program were not accessing a respite, or had programs that were no longer operating. And so instead of offering hands-on respite, they offered eyes-on respite that include virtual respite, something they called front porch respite, visiting families with musical programs or other interactive events. And then for families that were utilizing the voucher program to hire friends and family, or if they needed additional security about or feeling comfortable, the program helped construct interior barriers so that families could continue to feel safe using respite in their own homes. Nevada, Colorado, and Virginia all extended time limits for voucher use. I know a lot of you, when you're awarding vouchers to families, they have to use them within 3, 4, or 6 months. Many of you were able to extend those time limits until families felt more comfortable using respite. And we continue to collect this information, so I hope that you will continue to send us what changes you're implementing. If you're going back to the ways that you used to provide respite, or if that ever is going to be possible, please let us know that as well. We're continuing to do more formalized case studies. We just released 5 more case studies at the end of last week, including a case study of the Lifespan Respite Washington's voucher program. Thank you very much, Tracy, for providing information for that case study. So we do have a few that have looked at voucher programs as well. And I hope you'll all have a chance to take a look at those case studies at that link. And now we'd like to know a little bit about what changes you may have put in place for your respite voucher programs. So this is the next question. Which of the following changes did you make, if any, to your respite voucher program as a result of COVID? Please check all of them that apply. Again, if you need some further explanation, changes to caregiver care recipient eligibility might include changes in income requirements or eligibility related to disability. For changes to who can provide respite, did you change based on allowing now a provider who is also residing in the home? Did you change the age requirements or the relationship to the care recipient? Changes to the dollar amount of respite that you provided, or the length of time that the vouchers could be available? Changes to locations or definitions? Or if you didn't make any changes at all and continued with your respite voucher program the way it was already in place, that's fine too. And if you have other and can describe it in the chat, that would be great. Again, there are a lot of responses here, so we'll give people a little extra time to respond to this poll.
So while folks are taking it, Arizona said that they allow renewal in the following year if funds available before we offer it once, and then looked for new participants.
Great, thank you. Do another 15 seconds.
While people are still taking the poll, we're at 20, so 66%. Rachel shares that RCAW expanded allowable costs to include supplemental respite, i.e. lawn mowing, snow removal, meal prep, etc. And then it was also clarified that the adding of purchase of robotic pets, weighted blankets, fidget blankets for loved ones of caregivers. We have developed a survey that we will use to collect information from caregivers, and that comes out from Carrie. And then Amber just posted other, as Dina indicated, New York hasn't offered a voucher program yet.
Great. And here are the results. I'll share them with you. The top two seem to be changes to the dollar amount of the respite vouchers or the duration of the vouchers. And there are a handful of you who made no changes to your voucher program. For those of you who selected no changes, can you tell us either by unmuting yourselves if you still had high uptake among family caregivers using the vouchers, or how did you make them feel? Was there a need to make them feel comfortable to continue to use vouchers? You can write it in the chat or unmute yourselves. Just curious about that. Well, thank you all for taking those polls. I see a lot of things in the chat, and we're going to be very eager to take a look at those and give you a chance to tell us even more about your voucher respite program. As we did in 2018, we have the kindness of Nadine at who's the Oklahoma State Lifespan Respite grantee, in partnership with her partner, Sooner Success in Oklahoma, who developed the original respite voucher survey, and they have taken it on to modify the survey and disseminate it again and do the analysis. So we're very grateful to them, and I'm going to turn it over to Nadine to talk a little bit about the survey and what we hope we will get from you.
Yes, the survey, when we did that in 2018, I just had a lot of questions for Jill, and she go, how are other states doing this? And if our vouchers were $400 every 3 months, is that typical? Is that not typical? I mean, we just had all these questions. Do they pay the providers directly? Do they pay the caregivers directly? And Jill and I just kept kind of batting that around, and finally we decided, let's just do a survey. Let's find out what, really get into the nuts and bolts of what everybody's doing. And that really helped us guide us on where we want it to go. We'd been in a voucher program for several years, but it's sometimes good to take a fresh look, kind of step back and say, maybe we could do this differently. And we did make some changes based on the survey outcomes. But because we've got a lot of new people with the respite voucher funding now, and because of the pandemic, that has probably caused some more changes. And so we felt like with those two considerations, and then also looking at what sessions you guys might be interested in the future, we really wanted to throw a survey out there again. And I know we're kind of all survey fatigued, but this is important, and we hope you will look into taking the survey. I don't think there's anything else on that slide, Jill. So when you receive the survey, Jill's going to be sending that out. And when that does go out, it just covers the demographics, the numbers and eligibility of population served. That's one of the categories, the respite provider qualifications. And when you look at this, try not to get too far in the weeds. You kind of can when you're taking that survey. General responses are good on percentages and dollar amounts. We don't mean to get nitpicky on a lot of this. Just, I think generalities will be perfect. So just remember that when you're filling the survey out. Then again, the voucher implementation issues such as funding, process for verification of caregiver income, working caregiver eligibility, reimbursement of caregiver or provider, the administrative time per voucher or caregiver. Again, everybody's a little bit different. Liability and fraud prevention issues, case management, if you do that, if you don't do case management, written guidelines for planned or emergency vouchers, data collection methods. Those are all issues that even if you have been in a voucher program for a while, sometimes you feel like something may not be running real smoothly, and it's always nice to see you know, hey, Washington is doing it this way. Let's visit with them. And that's, I've gotten calls and I've called other states and said, can you kind of tell me how you're doing that? And it's just great to have kind of partners out there that can collaborate with you and be willing to share, and you share and learn from each other. So again, this was very, very helpful for us, the outcomes of this survey. So I hope you guys will take time and complete it. Next slide, Jill. One of the things we realized is that there were several people from each state responding to the survey. So we asked that you kind of coordinate your efforts in your survey and just one person from each state respond that does have the Lifespan Respite Voucher Program. Maybe the state agency do the lead, maybe a coalition person takes the voucher survey. Another organization that administers the vouchers on behalf of the grantee. We don't really care. It's just that before we might have gotten 2 or 3 responses from the same state, and some of the responses were different. So that's why we'd kind of like maybe some consistency and maybe just one person or one agency lead take the survey. We ask that you complete it online by March 15th, and Jill will be sending that out to you all. Anything else, Jill?
We did want to also give you an opportunity, not a lot of time, but maybe another few days. If you have any additional questions you'd like us to ask on the survey, or changes to the wording of any of the questions, if you could let us know by next Monday, I think at the latest, that would be wonderful. We still want to make sure that we're collecting the information that you want to have that will be helpful to you as you administer your own voucher program or plan to administer one. So I sent this out about a week ago in a PDF form, so you could take a look at the questions and let us know if you have any suggested changes. We're still open for that, and we'll take a few more days if you want to take another look at that survey and let us know if you have anything you want to add. Does anybody have any comments about the survey right now? I see Cheryl is asking, is the survey from past experience or future plans? And this might be unique to Nevada because their pilot is finished. I think it would be extremely helpful, Cheryl, to have information, even though your project is over, to know how that program was administered. And maybe if you're writing about a program that is not current, and I don't think there would be too many of you out there that would be doing that. But if you are, just to send us an email and let us know that you responded to the survey, but your program is not current. Or we might be able to add that question to the survey so we know. Anyone else have any questions or issues they'd like to add to the survey? I see Aletha from Rhode Island has already talked about their cost sharing respite program. And I only know of one other program that does cost sharing, and that's Montana. It's another interesting aspect of a voucher delivery program that we can learn about from this survey. And I think we should add a question about that too, Nadine, if we haven't already. I don't think we have a question about cost sharing, but I would really like to know if other programs are cost sharing.
And Joe's comment, Jill, from South Carolina, was they reduced the use of vouchers, but it's picking up now. And then North Dakota's voucher program was already very flexible, so few changes were needed. The number of requests have remained consistent.
Great, thank you all very much for that. Any other last minute comments before we move into the next part of our agenda, the small breakout groups?
Jill, it's Dina. I guess wanted to check and see. I don't know if it would be appropriate for thinking about, plans for future trainings, because it might be, I guess, more for New York. I don't know if others encounter this, but one of the things that we noticed in our work group meeting today is kind of some of the considerations for what should fall to local discretion. Because the way that we're building our voucher model would be that it could be, well, we're definitely going to be offering voucher models through Lifespan Respite funds through the coalition. You know, but the thinking is that we include our AAA network in these plans, because if the funds are ever to dry up, you know, where are these programs going to turn to for potentially additional funds? They're probably going to go back to their AAA. So it just seems to make sense to have a model that would work under both funding streams. But I think where we're encountering some, and we're in the very early stages, we're only in our second work group, but with some of the questions we've raised today to open the discussion and get their input, it does seem like some of the decisions we're going to have to make is kind of what falls to local discretion and what really needs to be set by the state office. And we probably have some flexibilities with that too, but I guess just in thinking, you know, from a systems perspective, right, of like what would make sense to have be set by us and what would make sense to allow some flexibilities locally. So I'm not sure if that would be appropriate for the larger audience, but just wanted to make mention that I could see that being a need for us.
Dina, I think that is an excellent question, especially in light of the Lifespan Respite statewide coordinated systems we had ultimately dreamed of when we developed this program back in 1997. In fact, the first program that Oklahoma developed in 1999, I don't even know if Nadine knows the history of this, but what they developed was a single statewide voucher program where multiple funding streams from the state flowed into a single voucher program. So the national, I remember meeting with the head of the National Family Caregiver Support Program at the time, and she said to me, "Oh, we love this Oklahoma voucher program because then we don't have to do our own voucher program. We could just give them our money and they can administer the vouchers." And that went along very well, probably for about 10 or 15 years. But then at some point, it reverted back to a more siloed system. So I think at some point, it might be interesting to hear how that happened in Oklahoma and why it reverted back, and the difficulties in trying to do a single statewide voucher program like that. But it is part of the Lifespan Respite concept to be thinking that way. It doesn't necessarily mean you have to implement a program that way, but I think they're very interesting questions that you raised, Dina, and we could have a really great discussion on that.
I would love to know what happened, because I remember telling people to go to Oklahoma and have a look at that system because it was so cool. So,
You know what everything comes down to? Money.
Money and people too.
Money. It came down to money. And when some of the programs fell out, everybody they didn't have the funding for certain, you know, segments of the population. And when that fell apart, it just kind of went back and to the programs that had the funding just started doing their own. But the way we run ours now is that Lifespan catches all those. We have 10 respite programs in Oklahoma and right now. And so when they're very connected through the coalition, so everybody that can't get respite comes to Lifespan. We catch those that fall between the cracks, and we serve everybody, and the other programs serve the others. So any entry point that anybody comes into for respite, we know each other well enough, we make the right referral. And if we know that they're going to get denied there, we just keep them within respite and serve them respite vouchers. So we still have even though we're not under one roof now, or it's not all fed into one place, we still have a very coordinated system because of our coalition, because we visit always, and we're always, well, like Ronell's on here and Robin are on here, but they know all the other programs like the back of their hand. They know it just as well. So that's what happened, Cassandra. It's all money.
And again, we make no value judgment of if one system is better than another, because every state is coming from a different place and has different strengths that they can build on. And I think ACL's perspective on Lifespan now too is also that Lifespan is more of a gap filling program. Doing exactly what you're talking about, serving those families that don't qualify for other public funding streams, rather than trying to have every public funding stream merged. I don't think that was necessarily the current intent, but all very interesting discussions for moving forward. Any other big pressing issues? That was a great one, Dina. Thank you.
I just have a follow-up question for Nadine. This is Carrie.
Mhm.
Do you ever find the need to add on or coordinate your Lifespan Respite funds with some of these other programs because the person just isn't getting enough?
Well, yes, but there's only so much money too. I mean,
Right.
we do run into that, but again, everything comes back to money. There is funding limitations, and we reach a lot of people, even though we just catch those that fall between the cracks of the other respite voucher programs, and we still have to watch it pretty close. And we only do $400 vouchers every 4 months, so it's not a lot of money anyway.
Oh, okay.
But yes, I mean, I have the coalition lobbying legislators. We need funding for this. So at this point, that's about and writing, grants for additional funding. But yes, there's always a need for more. But and we catch those too. We do have some programs that run out of funding before the end of the year. And so we will pick up those caregivers and supplement that program until their next cycle of funding comes available. But then we back off again. We don't supplant. We only will supplement if needed.
All right. That's a good collaboration. All right. Thank you.
Well, great start to this discussion. Our goal for the next 30 minutes was to give you all the opportunity to, and many of you already know each other very well, but there are some new people in the group too, to give you a chance to get to know each other a little bit and talk in small groups. As you all know, as this pandemic has gone on and may be going on for a little bit longer, we're all feeling somewhat socially isolated. We're feeling a little bit of stress, perhaps, in our own efforts to try to serve the family caregivers that we work with, maybe stress within our own organizations. And I think we all thought the Learning Collaborative leaders in Arch agreed that it's really important for us as a collaborative, if we really want to get down and dirty and talk to each other openly and honestly, to really know that we're not alone in the work that we're doing, that we have colleagues and friends in this network that we can turn to for information and guidance, but also for support. So we just wanted to give you this chance to talk in small groups. We have 3 questions that I shared with you on the agenda prior to the call that'll help guide our discussion, that primarily focus on your own work and personal experiences within your own coalitions or agencies, or in your work directly with caregivers during the pandemic, to talk about the challenges that you faced, but just as importantly, any of the successful strategies that you used to deal with those challenges. And we're not going to be recording the breakout session. So I hope you'll feel that you are in a safe and nurturing environment and can talk freely, share whatever's on your mind, and it won't go outside of the 35 of us that are on the call right now. I'm kind of new at doing these breakout groups, so if I screw up on the technology, please be patient with me. We're going to open up the breakout rooms and you'll be randomly assigned, and you'll each have a facilitator. Cassandra is going to be in room 5, Susan in room 4, Tracy in room 3, Ronelle in room 2, and Nadine in room 1. And they'll be guiding the discussion for you for 30 minutes. So we'll come back and share some major takeaways from that effort. Does anybody have any questions before I break you all up into groups? Just use it as a time to chat. Don't worry about getting through all the questions or following the questions exactly. It's really just a chance to open up and share and talk about whatever you want to.
And I was going to ask if we can see your faces, if you can show your video, that'd be great. You don't have to, but that's nice to see a face.
Okay, I'm going to open all of the rooms now and have everybody back now. I hope those sessions went very well. We've got about 10 minutes left in our learning collaborative, and I think it would be useful if we heard from each of our facilitators to share one, or if you've designated someone else in your group to share one major takeaway or any item that you'd like to share from your group. And we'll start with Nadine.
Well, we just kind of chatted. We started with question one and kind of went off on our own, but it was a good icebreaker. So yes, one of the things that I thought was a good takeaway, and I have not heard about, Jill, was help me, which state was it? Washington? No, Lisa's group. Wisconsin. They had the care packages like some of us did, and they now I could have got that wrong, Lisa. You want to tell it, Lisa? You tell the story about your passes.
We called it a meaningful activities opportunity. So there was a number of choices of a craft or puzzles or different things, but we also offered an annual state park pass. So people could drive through parks or go to parks or whatever. And that was like 90% of the requested item was having a state park pass.
Oh, that's interesting. I like that.
Isn't that neat, Jill? And that's in COVID, drive through a state park. Isn't that cool? I thought that was really neat. So that was the thing I've never heard anybody talk about. So good job, Lisa.
Group 2, Ronelle, did you have an item you'd like to share?
We had a great conversation, I think, and just like Nadine stated, a lot of similarities of things that programs are doing. My two ladies happened to be coworkers together, so that was kind of neat. And then my coworker got thrown in with me as well, so Robin was there. But I have to give kudos to Miss Abby and Amber. They were in my group, and I think it was Abby that had stated that it was during question 2 about assistance and support. She actually stated that she felt that caregivers were better served since COVID's occurred because we now have more flexibility. And I think that really hit me. I was like, think about that. And even us, as we talked about it some more, it is. I mean, and she talked about how they did the caregiver bags as well. They do virtual visits, weekly calls, just these different ways to check in with their caregivers and things that we might not have thought about had COVID not occurred. So I just thought that was a really good takeaway, that in a positive flip to COVID, that, our families are being better served because of this pandemic. So I thought that was really neat to share.
Yes, absolutely. I mean, that's how we all feel about the changes to Medicaid waivers. We hope those changes are permanent because they offer so much more flexibility to families. Room 3, Tracy.
Well, I posted that anybody is welcome to pipe in. Fabulous 3. No? Okay, well, I will do a little spark and then anybody can post other things in there. But we had a good representation of folks that have been in the voucher program. Nevada is resting. And so we had the wisdom there. We had wisdom from state. We had wisdom from planning and thinking about, to consumer driven, to lifespan respite projects that are voucher for. So we had the states of North Dakota, New York, and Arizona and Washington. And am I forgetting anything? Well, someone will chime it in. States represented. And, in essence, it was, support and COVID in what we've been doing in these times, and coming from offices and structures and systems in place to now being, jettisoned into working remotely, and what that's doing and how that impact is on our care recipients. Because again, our data shows in Washington 5 or more years not having a break at all. And so really that lifting of, being creative, but also just the hardships of those systems changes, and adapting, and just really acknowledging the creativity, but the tough, stressful time that this has been, with the resiliency. So I would really say group 3 really shared a lot of resiliency for how they're navigating this and acknowledging what the realities are. Thank you, group 3. I appreciate your wisdom.
Thank you, group 3. Group 4, Susan?
Group 4 was represented by Alabama, Idaho, Washington State, and a new person, Renata, and I didn't catch where Renata was from, so I
New
apologize.
Jersey. New Jersey.
Oh, New Jersey. Okay, thank you. So one of the things that stood out to me listening to these women is that they know what's going on. They're close to what their staff is experiencing. That's really a good sign. Alabama was actually able to add counseling services, but both Washington and Alabama provided support for caregivers. Sorry about my dog. I can't mute right now. For caregivers and care providers. So Washington was actually able to offer counseling to their staff once a month. Probably needed more, but that's really wonderful. There was the acknowledgement there that that could be needed. Washington talked about making referrals to parent and other organizations that offer natural connections. And Alabama did this as well. They had an array of different supports for caregivers, but there was a lot of attention in building peer-to-peer support, which I thought was a good strategy. No one said this, but just from my own experience doing crisis nursery work, one of the things that struck me is I think one of the hardest things is when we can't help, when we don't have any resources to help and we're hearing something painful. And so the fact that these organizations thought of such a diverse way to support caregivers is in and of itself supportive to care providers, because when parents and caregivers come to you, you have something to offer them rather than nothing to offer them. So I just thought that was a really wonderful thing. And then this has nothing to do with my group, but I just have to say about the state parks, I'm just researching this for something else. Being outdoors 2 hours a week, it lowers your blood pressure, decreases cortisol, a stress hormone in your body, measurably decreases anxiety and depression. And if you go with a friend, increases that peer-to-peer support. So that's like, I'm taking that away, Lisa. That was brilliant, the parks. So thank you. It was a great group.
I need to get those stats from you, Susan. So
I will.
I'll email you.
I'll send this to you.
Thank you.
And just to chime in on the state park things, I know I can only speak for Oklahoma, but a lot of our state parks, they have like little booklets or little medallions that if you go to them, you can get these things and collect them as you go to each of the state parks. So you might check within your states if they have that. So that's a neat little incentive. Hey, I've been to this state park. Here's my, and it's for adults and children alike that can do this. So it's a little tidbit.
Very cool. I like that. Group 5, Cassandra.
Well, I don't know if I have time to talk. I want to get in my car and go to the closest state park.
Me too.
We had another really wonderful group. Nevada, South Carolina, and Arizona were represented. One thing, since not South Carolina, but the rest of us are on the West Coast, and it was brought up, and I completely forgot that this year was more than just the pandemic. Other disasters, the fires were really significant, and that there had to be some disaster planning going on, not only with staff and with providers and care recipients, because there have to be plans made for moving out of a house, protecting themselves. But a lot of resilience was seen. One of the good things, now it was presented not necessarily as a good thing, but the idea that, and this was Nevada, the Division of Child and Family Services was making referrals, more referrals than normal for respite, because they didn't really know before the mental health connections to the need for respite. And so there was a new awareness of respite and more of a demand because of the pandemic. So those were just a few of the many things we discussed.
Wow. Just from the short time that you were able to meet, I think we generated and shared a lot of really interesting ideas. Tell me, what did you all think of doing these little breakout groups during our learning collaboratives? Would you like to see more of it and for greater amounts of time during the learning collaborative? Instead of hearing me talk, I'm sure that's true. If we just get the technology down, this will be good to go. Excellent. Are there some of you who have concerns about doing these smaller groups? Or things we could have done differently?
No, I just want to know how you did it. So.
Zoom makes it so easy now. You just click a little button that says breakout rooms. It is easier than I made it look. You just have to practice a little bit. Does anybody have any other last minute thoughts or big voucher questions you were really hoping to get answered today that we can add to our list, or somebody can respond to real quickly before we end the call?
Please complete the survey.
Yes, please complete the survey or send us any additional questions or changes by next Monday. We will disseminate it officially next Monday or Tuesday. Great. Well, we meet quarterly, so the Learning Collaborative leaders will be meeting in the next month or two and setting our next meeting, hopefully sometime in the next 3 months or so. That may be dependent on when the new funding opportunity announcement opens from ACL for the new grant period. Sometimes it's a little bit hard for us to offer the kind of training and technical assistance we'd like to when the funding opportunity announcement is open, but we'll stay flexible. We'll keep you updated on that too. So everybody have a really wonderful rest of your afternoon, and we'll be in touch. Thank you all so much. It was great seeing you all.
Thanks, Jill.
Bye, everybody.